Hi, everybody. Thank you for joining us today. We're going to get started in just a minute. It's at 12 o'clock, so we're going to get started. Welcome to the Kinship Navigators Monthly Lunch and Learn series. My name is Rae Glaser. I'm the director of the New York State Kinship Navigator Program. We come together once a month to do a half an hour informative session for kinship caregivers or people working with kinship care called our monthly lunch and learn services. Just a reminder, everybody is on mute for the duration of this webinar. If you have questions, please feel free to drop them in the chat. I will monitor the chat as our presenter speaks. And anyone that registered for this event, you will get the PowerPoint slides and the video recording within the next week. So thank you for joining us today. I do want to give a thank you to the Times Union for their media sponsorship of our Lunch and Learn series for February, March, and April. Their advertising helps us reach new audiences. So thank you very much to the Times Union for your support. We appreciate it. Many of you know me. Like I said, my name is Rae Glaser. I work for the New York State Kinship Navigator Program. The Navigator is the one that puts on these lunch and learns. They are typically the third Thursday of every month from 12 to 12:30. Although with the kiddos' school schedules, we've moved some of them around because next week a lot of the kids are on break. So we wanted to make sure we accommodated that. Our next Lunch and Learn will be on May 15th, and we have targeted the Foster Care Youth Initiative program to speak about scholarships for foster children. We are always seeking ideas for Lunch and Learn, so if you have any thoughts, you see a need in the community, we do try to make them statewide. Feel free to email me directly. My email will be right in the chat, although I think everybody knows it. And just for you that are not aware, the New York State Kinship Navigator Program, we work with kinship caregivers, professionals, prospective kinship caregivers to provide information, referral, and education on a statewide level. So our helpline is available 10 to 4, Monday through Friday, in a variety of different languages. We speak with caregivers to find out what their current needs are. We screen them for financial assistance as well as legal permanency, make sure that they know all of their options for both of those big ticket items. And then we make referrals to local kinship programs and permanency resource centers, as well as other supportive agencies across the state. If you have a caregiver, you're looking to get in contact with us, feel free to give them our phone number. If you're working with somebody that is a caregiver and you want to use our permission to contact form, that's right on our homepage, www.nysnavigator.org, and we are very happy to work with your agency. Without further ado, I'm going to turn it over to our speaker today, Misha Marvel from Hunger Solutions New York, to give us a little bit more information on helping our families access nutrition security programs. Over to you, Misha.
Thank you so much, Rae. I really do appreciate you inviting me to share some updates and context and background on WIC and SNAP and other child nutrition programs today, and really also why it's so important for more families to connect more families with these public health and nutrition services. Hi, everybody. I am, as Rae said, the manager for early childhood nutrition policy and engagement at Hunger Solutions New York. And I'm going to be advancing my slides, so hopefully that scooched forward. Before I dive in, for those of you who might not be familiar with our organization, just to introduce ourselves, Hunger Solutions New York is a statewide nonprofit anti-hunger organization. We focus squarely on USDA's federal nutrition security programs, and we work to maximize participation among all who are eligible, among all the age groups. We were founded in the mid-1980s and primarily worked on SNAP. And over the year, which was called food stamps back then, over the years, we've added work on child nutrition programs such as school meals, summer meals, childcare meals, and began work on WIC a few years before COVID through a targeted outreach contract that we still have with the New York State Department of Health. The way we go about our mission and much of our work is a combination of community-based services, statewide services, and administrative and legislative advocacy. We provide information and resources and technical assistance to parents and caregivers and community-based organizations and school administrators, teachers, WIC agencies, after-school program providers, and many other groups. And we advocate for policies that contribute to ending hunger at the local and the state and the federal levels. And we do a lot of our work in partnership and in coalition with as many stakeholders as we can. And we absolutely believe that we are all more effective when we work together. So just to level set everybody a little bit, this map of New York State is from Feeding America's Map the Meal Gap. It's an interactive food insecurity resource. The darker green counties or areas indicate a higher prevalence of food insecurity within those counties. Overall, the most recent data that that we have available was in 2022. The child food insecurity rate in our state was 18.8%, nearly 20%, 1 in 5 kids, and that equated to nearly 750,000 children across the state. We know there are many and long-lasting consequences of food insecurity in children. It inhibits social, emotional, and cognitive development. It negatively impacts a student's ability to engage in the classroom and learn, and it contributes to toxic stress and poor health outcomes. I'm going to spend the bulk of our time today on WIC because we want to make sure that you know about the improvements to this public health service program over the last few years. We know that proper nutrition is vital at all phases of life, especially before birth and through a child's first 5 years. Nutrition education is a core benefit and one of the reasons why WIC has been so effective for 50 years. In fact, over 90% of mothers with children on WIC as toddlers and preschoolers, they found the nutrition education component of WIC as important as the food that they receive. WIC's focus is improving access to fresh and nutritious foods in the communities where participants live. And participation in WIC is linked to better overall dietary quality, increased consumption of fruit and vegetables, and reduced intake of added sugars. So depending on a participant's nutritional needs and the conversations with the WIC's registered dietitians, their WIC-approved food package items may include food staples such as protein, like eggs, peanut butter, canned or dried beans, tofu, canned fish, dairy, milk, yogurt, and cheese, or dairy alternatives like soy milk, whole grains, whether pasta, brown rice, hot and cold breakfast cereals, bread, tortillas, and then fruits and vegetables, whether they're fresh or frozen or canned in 100% fruit juice. And then, of course, baby food, jarred fruits, vegetables, and meats, and infant cereal. And for those babies who are not breastfed, infant formula. And in addition, a WIC participant's food package is customized or can be customized to meet special dietary and cultural needs. So vegan, kosher, halal, for example. And we are super excited that last year USDA updated WIC's food package for the first time in about a decade and aligned it with current nutrition science recommendations, and also is going to be offering more flexibility and choice for participants. So states right now, including our state, is in the middle of a 2-year rollout for updating that package. So we got about a year to go. The state's working really hard to get it out sooner if possible. And we're really excited for these important updates and changes that should be coming, in this next year. Some of you may be very familiar with WIC from many years past or not so long ago, and may have even been a WIC participant yourself. Please don't tune out from what I'm going to share over the next few slides, because I'm sharing these things because community partners already working with eligible families have told us time and time again over the last couple of years that they did not know what I'm going to be sharing with you today. And they didn't know WIC has been so underused for many years. We've learned that we really need to consistently and repeatedly share the recent improvements and modernizations in WIC so that families really know what they're missing out on if they choose not to participate. So in the next few minutes, I'm going to dig into a couple topics such as I've already mentioned public health services, recent modernizations of WIC services like the eWIC card and the WIC to go app, flexibilities and enhanced benefits due to COVID-19, as well as some participation rates. So actually, participation really is why I'm highlighting WIC today. Even before COVID, many eligible people across New York and across the country actually were not participating, especially pregnant women and children ages 3 and 4. And then, although since early 2020, New York State WIC has seen a 25% increase in participation, and we're now serving about 450,000 women, infants, and young children across the state. The State Department of Health estimates that we are still only serving about 2/3 of eligible New Yorkers. And so I share this in part because many of us did not know that WIC enrollment and participation had been declining for about a decade before COVID. And we're doing this webinar in part just to really help turn the low numbers around in your area. I'm going to take a couple minutes now to share some basic information we hear from partners needing some reminding and repeating, and then some updates on WIC. And so, for example, as this little girl is so surprised about, participating in WIC has never been easier because you can get WIC benefits from home. First, who's eligible for WIC? Somebody may be eligible for WIC simply if they're pregnant, as soon as they find out that they're pregnant. A mom of a baby who is up to 6 months old. A mom of a breastfeeding baby who's up to 12 months old. Or a child under the age of 5. And again, of these eligible groups, pregnant women and preschoolers have the lowest participation and coverage rate among the possible participants. And to get WIC, a mom and or a child must simply live in New York State, have a New York State address, and have income below a certain amount. It's at 185% of poverty. Right now, that's nearly a 48,000 for a family of 3, or nearly 58,000 for a family of 4. Or if they get benefits from SNAP, Medicaid, or TANF, that makes them automatically eligible for WIC too. And coming next month in May, there's 2 other programs that will be added to this list of automatically eligible programs. I'm not sure I'm able to say those names right now, but it is coming. We're super excited, and stay tuned and sign up and you'll get the next news. And then before I move on, I just want to note that an unborn child can be counted as a member of the household, so that a pregnant mom can count as 2 people for income eligibility purposes. And just underscore and emphasize again, dads and kinship caregivers and foster parents and guardians and step parents can apply for WIC on behalf of the children in their care.
Misha, just so I'm understanding, I'm 99% sure I know the answer to this.
Yeah.
A guardian or a kinship caregiver is applying, even though a child under 5 is eligible for it. Is it the household income that is calculated for WIC, or is it just the child's income?
So if it's a foster child, it's the child's income.
Okay.
So the foster child is considered a household of 1.
Yeah.
If it's not a foster child, but it's in a kinship caregiving situation, it's the family income.
That's what we thought. It's different, for all the benefits across.
I know,
So
I know. Yep.
it is the family income, though. That makes sense.
Mhm.
Thank you for that.
Yep. Except for foster.
Except for
child.
foster. Yep.
All right. So this slide shows a photo of an EWIC card on the left, and the main screen of the New York State WIC to Go app on the right. And I share them because New York finished, a 1-year-long statewide rollout of EWIC in the summer of 2019. And we're really still hearing people are not aware that WIC food benefits are no longer provided on large paper checks like they had for 45 years prior. And I think this really makes sense, really, with the pandemic starting soon after the EWIC started. But if you're familiar with the WIC program before 2020, this is just really good news about WIC. So like I said, in the past, WIC food benefits were issued and listed out on paper checks, and a family had to buy everything on their checks food list all at once when they went to the store. And that's not the case anymore. So the EWIC card acts just like a debit card. It's swiped at the register. Families can shop when it works best for them, either all at once or go back to the store as many times as they need until they use all their benefits by the end of their 30-day WIC cycle. And then unused, unredeemed benefits are removed and the new month's benefits are added. So, and then also due to the pandemic, as I mentioned earlier, many local WIC clinics are allowed to provide services remote over the phone or on video chat. And they're able to load those eWIC cards remotely as well. And this includes significantly increased monthly benefits for fruit and vegetables. So this slide shows a photo of Wanda, the newest modernization for New York State WIC. Wanda is officially called a virtual assistant. Some call her a chatbot. She's got a reader-friendly and chatty tone. She asks potential participants questions that pre-screened for WIC eligibility in just about 3 minutes. Families can learn about WIC services, find out if they may be eligible, and then get a hot referral to WIC clinics near them. So Wanda, with their permission, will give their contact information to their local WIC agency, who will then follow up with them in the next couple days. So Wanda's easy to use on a computer or a tablet or a phone. She was in a pilot phase for a few years, and so she was only chatting in English. But as of about a year ago, she now chats in Spanish too. And then here is a screenshot of part of wichelpny.org. When people visit the website, they can find basic and reader-friendly information about WIC, and our website can be translated into 10 languages. We include New York's Growing Up Healthy hotline, so families can call and learn about all sorts of services. We also include the link to all of the WIC agencies across the state, and of course there's a link to Wanda. And then there's also a link to a short video on how people would use their eWIC card. So in the resource center portion of the site, there are a number of different outreach pieces and fact sheets, including many in Spanish, that partners can use. And some of the materials partners can actually order in bulk for free right off the website. There's an order form on there. We're going to be adding many more resources and in additional languages. And so please keep this resource center in mind with the families that you work with, and sign up for our e-news so that you'll get alerts when we've added more. So to recap on WIC, New York State reaches 65% of eligible New Yorkers. We've got 35% more to go. There is a difference between upstate and New York City. The coverage rate for WIC is much less outside of New York City and among, as I mentioned before, the age groups other than infants. And so pregnant women, children ages 2 to 4, and children in the care of non-maternal caregivers are especially underserved. So we have a variety of materials that you're welcome to use and help spread the word on the wichelpny.org resource center. And then before I move on, I have to say we continue to educate our congressional representatives and advocate that WIC be fully funded to serve all eligible people who request services, as it has earned and had strong bipartisan commitment for the last 30 years. And the remote services I mentioned are actually temporary and need to be made permanent by Congress. They were made allowable because of COVID and the pandemic. And if they are not made permanent by their expiration date of September of next year, September 2026, states and local WIC offices will be forced to require participants to use only in-person services again, and that's going to make it harder for families to participate. And we can talk about this more in the Q&A portion if you like. But again, before I move on, I just want to encourage those of you who work with kinship caregivers to reach out to your local WIC agencies and create a referral partnership with them. And we're happy to help facilitate that connection. And I do think I mentioned earlier that the wichelpny.org website main page includes a link to all the local WIC clinics. So you can do a drop down with your county and find out where are the locations in your area. So next, I'm going to just briefly touch on a few other important nutrition security programs that are available to many more New Yorkers. And I'm going to start with SNAP because it's our country's largest anti-hunger program, and it helps mostly working families, senior citizens, and people with significant disabilities to feed their families. And there's a growing body of research that shows how SNAP can safeguard against food insecurity and improve the health and the academic and the employment outcomes for growing children. So here are the income guidelines for SNAP. And I'm showing monthly income here because SNAP eligibility is based on a person's most recent monthly income. It's really designed to pivot and really adapt to a household's immediate financial situation. And then most people are certified for up to a year. At the bottom of here, I'm not sure if you can see my little arrow, households with an elderly, and unfortunately USDA determines elderly as people age 60 or over, which I know many of us have a different, don't think of 60-year-olds as elderly, but that's what it is. Households with elderly or disabled members or out-of-pocket dependent care costs, which include childcare costs. They could be income eligible at 200% of poverty. Then only for severely disabled and elderly people with disabilities living with others and unable to purchase and prepare their own food, the income guidelines are 165. So it varies depending on your household situation. And then the SNAP benefit amount a family will receive depends on both their household size and their household income. So this slide shows the maximum benefit a household can receive based on their household size. During the pandemic, everyone received the maximum benefit since that public health emergency was lifted and that special circumstance was removed. Now we are back to pre-pandemic rules. So, unlike WIC, if a person or if a family has countable income, that income could reduce the amount of SNAP benefits that they receive. It's on a sliding scale situation. With SNAP, then the lower the income, including allowable deductions, the higher the benefits, and the higher the income, the lower their benefit amount would be. For WIC, a participant is either yes or no, eligible based on income or ineligible based on their income. And then the food benefits are the same for everybody, determined according to their health and their nutrition needs, whether they're pregnant or postpartum, breastfeeding, or an infant or a young child.
That makes it a lot simpler, Misha.
Yeah, it is super. WIC is much simpler. Yeah.
Yeah, we do have a question coming in. It's similar to the one I asked, so I just want to check my understanding. The question is kinship placement of the child, but the child is receiving Medicaid benefits through the non-parent caregiver benefit, and the caregiver is a guardian. So it's not a foster care situation. The question is the income of the guardian counted? I believe the answer is yes. So I'm checking my understanding right now.
If the child is the child, I'm not sure is the child receiving Medicaid?
So we have in the population we work with, it is based on the child's income for Medicaid only.
Okay.
In 99% of circumstances, because if it's not a bio parent or an adoptive parent, they don't count the income. But if the child is receiving Medicaid and they have a legal guardian, not, like it's a kinship guardian, it is not a kinship foster parent. I believe it is similar to SNAP benefits where the whole household income is considered. Is that correct?
I believe so too. I'm not 100%. I would encourage a person to go ahead and use Wanda and find out. And then I can also follow up and find out special and send that out in the follow-up materials with folk.
100%. Heidi will have some contact info at the end of the presentation so you can follow up on that. And then the second question that came in is how can dads that are the custodial parents apply for WIC?
The same way anybody else does. So connect with Wanda and you'll get hooked up with your local WIC agency that you'd like to work with. It doesn't have to be in your same county. It can cross county lines because of these remote services that are available. It would be the same as everybody else. Yeah.
I think sometimes the name throws people, so that's
I know. Yeah,
no.
Yes, it absolutely does, which is why we have the state recognizes and why when we've identified through a statewide needs assessment the populations of potential WIC participants who are not participating, and dads and primary caregivers are in that large population of unparticipating because of, I think,
Some of them, yeah. So it's
women,
good to have
women
you
in
here
the
to debunk that. We appreciate that.
exactly, exactly. So, but when people do get SNAP, if they aren't aware, they also have SNAP benefits are loaded onto a EBT, like a debit card, and can be used to purchase food, herbs and honey, as well as plants and seeds that grow food. There are many authorized SNAP retailers across the state. Benefits can be redeemed at local markets and stores and farmers markets, and some online retailers as well. And then some communities may or agencies may offer additional coupons and incentives that like better leverage your SNAP benefits. There's the Senior Farmers Market Nutrition Program. There's the Fresh Connect checks. There's Health Bucks. Get the good stuff. I think it's in New York City, and Double Up Food Box. Or Food Bucks. There's just a variety of other programs that across the state in some areas of the state. And then many families are actually, and this is a big myth as well, people think they can only get one or the other. Many families are eligible for both WIC and SNAP and really should be receiving both. And we want to remind those families when they do receive both benefits to please use your WIC benefits first at the checkout to avoid losing any value at the end of the month. So like again, I mentioned before, WIC benefits expire at the end of a person's 30-day benefit cycle. However, SNAP benefits can roll over from month to month and expire, I think, the next year. We have 12 months to use those benefits. So now for 40 years, USDA and New York State both have recognized that many people may not know that they're eligible for SNAP, or they may need some extra help applying. The application is difficult for some people to get through. NOUP, the Nutrition Outreach and Education Program, is a nationally recognized SNAP outreach and education program, and it's in most of the counties in our state. Services are always free and confidential. They're provided by local NOUP coordinators who are employed by community organizations. And for counties that do not currently have NOUP services, please know that Hunger Solutions New York, we have bilingual staff that assist people too. We manage the NOUP program and have managed it for close to 40 years now. So for those of you in the NOUP service areas, we hope that you already connect with your local NOUP coordinator, but just in case, I'll share their services include pre-screening, helping applicants gather their documents, and fill out and submit the SNAP application. Many of them offer translation services, in-person, in-home appointments, or meeting at a public location that's convenient for the applicant, and of course, email over the phone assistance. And NOUP coordinators work to make sure that applicants get the full benefit that they are fully eligible for, not just the minimum benefit. Our webpage, foodhelpny.org, has an interactive mapper where you can find your local NOUP coordinator. It's organized by upstate and New York City, so just make sure you click on which orange tab you need before you get started, and then you can drop down your county. And again, SNAP can be an intimidating and complicated process for some people, but NOUP coordinators in your community are really the experts in all of the rules, and they can help pre-screen people and help navigate the SNAP application process. I'm going to move on to USDA's Summer Food Service Program. Summer Meals provides federal funding for local schools and community organizations to serve free and healthy meals for kids and teens over the summer break when kids lose access to healthy school breakfast and lunch. The State Ed Department administers the program by working with area sponsoring organizations such as schools or food banks, summer day camps, and many others that all serve meals at various sites. The sites are the places where the children eat their summer meal. And last summer, 2024, this program allowed schools and community organizations to serve free meals at about 2,500 sites across the state. The vast majority of the summer meal sites are considered open sites, which is exactly what it sounds like. They are open to all kids and teens in the community. Anyone age 18 and under can drop by for a meal at no cost. There's no application process. There's no paperwork for the family. And there's no income requirement proof test for the families either. Traditionally, kids are required to eat together at most sites, but a new flexibility allows for, we call it a grab and go, or kind of like home delivered meals in eligible rural areas, when and where in-person meal service is not available. And then as of last summer, 2024, families may now receive food benefits per eligible child on an EBT card. Summer EBT benefits can be used just like SNAP benefits to buy food at the grocery store, the farmer's market, and other SNAP authorized retailers. These benefits combined, again, you don't have to participate in one or another. All of the nutrition programs you're eligible for, SNAP and WIC and summer meal sites and summer EBT, help ensure children's access to healthy food while school is out. Most eligible children will receive summer EBT benefits automatically. Some will need to apply, and our website has information on both summer meals and the summer EBT to help get the word out about both of these programs. So I've gone over a lot of different resources. We're kind of at the end of our time. And you might be wondering, what can I do? It's really simple. We just ask that you consider connecting with the resources that can easily help your community or your family, and share even just a little bit about what you learned today with colleagues, with families and encourage them to connect to these programs as well. And so again, thanks, Rae, for having me, and for everybody here today or listening later on the recording, for all that you do to support your community. Whether you're a kinship caregiver yourself or you work with caregivers, we really hope you will consider us as partners in your most critical work.
Misha,
And
thank
then,
you so much.
yeah,
Yep. Oh, you see, you got your contact information. That's much appreciated.
sure,
To everybody on the webinar, we will send that out absolutely within the next week, so you've got access. Thank you for joining us. Really helpful information. Looking forward to continuing working with you. And
sure.
thanks for
Yeah,
everybody on the call for joining us today. We will see you next month.
cool.
Thanks a
Thank
lot.
you.
Bye.
Bye-bye.